It seems that repressed memories is the latest fad among therapists. Their unorthodox methodology is used to retrieve memories of childhood incest in order to explain away adult problems. Thousands of women who have made allegations of sexual abuse against their parents as a result of recovered memory therapy have been victims of this dangerous fad. Their memories may have been created through suggestion and invasive therapy techniques, especially if there is no corroboration evidence of any abuse. The results are often devastating to the patient's family, who may not only lose contact with their child, but can be civilly and criminally sued for acts that they never committed. Starting in the late 1980s, many mental health professionals embraced a new miracle therapy called repressed memory therapy. These less than well-trained therapists claimed that the majority of American women had been molested as children and that most of them had repressed the memories of abuse. They believed that this molestation and its repression were the keys to the emotional and physical ills of these patients. They recommended that when the therapist engages a patient to recover these memories of abuse, the patient can overcome her problems. Advocates of these ideas have written books and articles and speak at self-help conferences and actively encourage these questionable and unprofessional and unscientific techniques for the recovery of childhood memories of sexual abuse. As a result of this repressed memory therapy, thousands of women who previously had no memories or suspicion of abuse before, came to believe that they were victims of molestation. The abusers are the patient's own fathers, mothers, brothers, uncles, or other relatives and friends. Almost 20% of these women have also recovered memories of satanic ritual abuse and all of its horrors: baby sacrifices, murder, multi-generational abuse, and mutilation. Some have even reported memories of abuse in past lives, during alien space abductions, and so on. Writers and therapists who advocate repressed memory therapy cloak themselves in scientific rhetoric and misuse legitimate psychological concerns in order to give their beliefs credibility. Repression, disassociation, post-traumatic stress disorder, multiple personality disorder, and a pseudoscientific phenomena called body memories are all part of the grab bag of terms that they use to convince patients that they show symptoms of abuse, even if they have no memory of such acts. Proponents of repressed memory therapy claim that memory acts like a video camera. It records a person's experience, even those in the womb, so indelibly that later experience or interpretation cannot change these images. They consider these internal video memories factual and pristine. This is the basis for the movement, and any technique used in therapy to gain access to these pictures is seen as justifiable. Advocates ignore the possibility that their techniques not only distort memories, but actually create pseudo-memories as well. Typically, repressed memory therapy encompasses several stages. In the first stage, the therapist employs a list of symptoms that are used as proof that there are repressed memories of childhood sexual abuse. These symptoms number in the hundreds and include headaches, vaginal infections, sleep disturbance, stomach aches, dizziness, eating disorders, fear of eating foods such as banana or tapioca pudding, problems maintaining stable relationships, a penchant for wearing baggy clothes, obesity, depression, or low self-esteem. It is a rare individual who hasn't displayed or experienced one of these symptoms during his or her life. Yet proponents of repressed memory therapy and the repressed memory movement acknowledge only one cause: repressed memories of childhood sexual abuse. The next phase of this so-called therapy is designed to convince the patient that she was abused whether or not she can remember it. She is told that only by believing in the sexual abuse and recovering the memories of abuse can she heal. Most patients who enter therapy are emotionally vulnerable, so the therapist, in a position of authority and trust, can easily accomplish an indoctrination. Should the client be reluctant to believe in the abuse, the therapist explains that she is in denial and can use pop psychology books like The Courage to Heal, for example, as a guide for women survivors of childhood sexual abuse to support their theories of repressed memories. The authors of this book, Ellen Bass and Laura Davis, write, quote, If you think you were abused and your life shows the symptoms, then you were. And if you don't remember your abuse, you are not alone. Many don't have memories. This doesn't mean they weren't abused." Unquote. In another such book, Secret Survivors, Uncovering Incest and Its After Effects in Women, E. Sue Bloom supports Bass and Davis when she states that, quote, "Incest is easily the greatest single underlying reason why women seek therapy or other treatment," unquote. She goes on to say, quote, "Many, if not most, incest survivors do not know that the abuse has even occurred," unquote. It is important to keep in mind that there is no scientifically proven list of typical symptoms of sexual abuse. Symptoms displayed by actual abuse victims are the kinds of symptoms that also result from other emotional or physical trauma, such as divorce, moving, illness in the family, accidents, loss of family members, new marriages, even changes in employment. But it seems that the repressed memory folks don't understand this. Once the patient is convinced that her problems can be cured by remembering the childhood sexual abuse, the third phase begins. The patient is encouraged to uncover molestation experience by imagination or hypnotic trance. Some repressed memory therapists even use sodium pentothal as a truth serum in an effort to verify memories recovered during hypnosis. Other highly questionable methods incorporated into this therapy are guided imagery, age regression, inner child work, relaxation therapy, channeling, trance writing, rebirthing, and even crystal reading. Therapists often place patients in incest survivor support groups, where new victims are surrounded by other women who have either recovered their own abuse memories or are in the process of recovering them. Therapists often place patients in incest survivor support groups, where new victims are surrounded by other women who have either recovered their own abuse memories or are in the process of recovering them. There, the patient is encouraged and sometimes even pressured by group members to remember and verbally describe incidents of sexual abuse. The final step in repressed memory healing is designed to enable the patient to believe in any and all recovered memories. Again, if patients are reluctant or doubt the details of their memories, therapists call on a publication like Courage to Heal and the Courage to Heal Workbook or Secret Survivors, where incest survivors are taught how to believe their flashbacks, body memories, recollections of abuse, no matter how bizarre the details may be. These patients are told that there is no need for corroboration or proof because what is recalled is historically accurate and unalterable. Their memory, they are told, acts as a videotape of their lives. These therapists remove themselves from the professional responsibility of examining statements or looking for corroboration by explaining that they are neither the police nor investigators. They say they are merely facilitators to help women become whole and healthy. Once patients believe in these recovered memories, they are told that it is then possible to begin the healing process. Patients are encouraged to sever their relationships with the abuser and any family member or friend who does not believe in the allegation. There are other support groups to attend that often incorporate primal scream therapy or physical violence to help work out the anger that patients feel about their recovered memories. These patients are often told that they may sue the alleged abuser in order to gain control of their lives, and with that act, they become survivors. How do other members of the mental health community and law enforcement regard this new methodology? First of all, many point to the troubling disregard for scientific research that is available to all mental health professionals. Richard Ossie, a professor at the University of California at Berkeley, a nationally recognized expert in suggestibility and brainwashing techniques, writes, "Even if well-intentioned, the therapists in this movement are like the physicians who once bled patients in order to cure them. But unlike those physicians who are limited by the primitive state of medical knowledge of their time, the promoters of repressed memory therapy ignore reliable research, misuse their